Hello everyone, this is Sandeep Sharma here. So the NEET results are out. Some of you have done exceedingly well and a big round of applause for you. Congratulations to all those who have got great numbers, great ranks. The next phase of your life begins. Go on, do your best, try to excel in whatever branch you take and always be ethical in life. But this video I'm going to put my perspective regarding people who have not done that well in the NEET PG exam. I've got a lot of requests, lot of messages in my inbox, on my mail, on my YouTube page. So in the next 5 or 7 minutes or 10 minutes, I'll be just telling you briefly about what my perspective is. So if you are having a rank, say above 1500, 2000, or beyond 2000 ranks, and you are not probably getting a seat of your choice. If you are getting a seat of your choice, go for it and end this rat race forever. But if you are not getting a seat of your choice, my suggestion would be, first of all, take a seat. Whatever rank you have got, do not undervalue your rank, do not undervalue your seat. There are people who have not got where you have reached so far. So take a seat and remember that branch is more important than the place. If you wanted to be a dermatologist, if you wanted to be a radiologist, doing radiology or dermatology from a peripheral place is better than doing a branch which you never wanted to do from a top place. None of the places you'll be getting through the NEET PG counseling would be at par with, say, AIMS or PGI. So the branch is more important than the place. This is one thing which you need to understand. And secondly, even if you take up a branch and suppose you don't get a branch of your choice, you must give another shot at the mid-year exam. If you have got a rank between 2000 to 5000, that means you have got a score of in excess of 650 to 700. And that means you are at a certain level. It's just the polishing which needs to be done for the mid-year exam. There is no harm in that. See, you take up a seat, you like your place, you continue with that. But end of the day, if you want to take a parting shot at mid-year exams, there is no harm in that. When you leave your seat, obviously you'll have to pay some penalty, some bond will come into force. That will vary from place to place, which will be clear according to the NEET counseling details when they will be out. But the summary of this is 2000 to 5000 or 6000. If you are getting a seat of your choice, seat branch is more important than the place. If you're not getting a seat of your choice, still get hold of the best possible branch and take another shot at the mid-year exams, right? And if you have a rank, say, between 6000 to 12000, then the debate becomes a bit more clumsy. Whether to go in for MD seats, MD MS seats, or to go in for DNB, or whether to go in for private colleges or to go in for government colleges. See, government colleges, of course, they are much cheaper, and most of them, not all of them, but most of them, usually they are better suited as compared to private colleges. The only exceptions being colleges like Manipal. The only bigger issue with private medical colleges is the exorbitant amount of fees, and sometimes you may not get the desired academic results in that. So it becomes a very personal choice depending upon your scenario, your economic conditions, as well as the amount of risk you are willing to take. Regarding MD versus DNB, I'll be putting a separate video, separate post. What are the pros and cons of that? If you ask in one minute, MD and DNB are virtually at par, except if you are trying to sit for, if you have plans to go in for assistant professorship or to become a faculty at a medical college. The rules there become different depending upon the place from where you have done your DNB. Other than that, MD and DNB in terms of DM and MCH qualification, in terms of private practice, in terms of corporate settings, everything is virtually the same. So there is no difference between MD and DNB. So if you are getting a MD MS in say a paraclinical branch and you always wanted to do a clinical branch, it is always better to go in for the clinical DNB. Keep it in mind that getting into MD is difficult, but coming out of it is easy. In DNB, the exit is a bit tricky because you have to sit and you have to prepare really hard. The exit exam for DNB, the passing rate although they have improved, but they are much less as compared to MD. More about it I will discuss later. It all comes down to how much risk you are willing to take and what are your future prospects. So no generalizations can be formed regarding that, so I'll take it up separately. And for those who have got ranks in excess of 10,000, 12,000 or 15,000, you have two or three choices. Number one, you can go in for some peripheral branches in paraclinical subjects through All India PG counseling. Second option, you can try for clinicals through the state counseling, which you might be getting in certain states. Third option, again, DNB you can take in some of the, obviously at these ranks you will not be getting very good centers, but if you don't want to take risk, you can always go in for DNB clinicals or DNB paraclinicals also. And obviously people with rank 2000 till 15,000 and beyond, you don't have an option. You have to take another shot at the mid-year exams if you are not getting a seat of your choice. If you're getting a seat of your choice, you're satisfied with it, it's okay, just finish off the rat race. Now, a lot of queries are there, sir, whether to take a drop or not. I'll keep it simple. If you have already taken 2 or 3 drops in the past, I would suggest that whatever seat you are getting, take a seat of your choice. See, nobody is doubting your ability to perform in the exam, but we are all humans. What is seen normally is, when you keep on preparing year after year after year, your scores reaches a plateau and it does not rise beyond that. So unless you had a valid reason that you got married or you had a personal problem or you had a health problem, so you could not perform well, if those problems are there, then obviously you should take another chance. But if you tried your best and you still did not get a seat of your choice and you are getting a rank, say between 10,000 to 15,000, look at the options which are available to you and settle for the best possible option. You may not get the seat of your choice, but ask yourself, does every person who gets MD radio diagnosis or MD pediatrics or MD obs gynae does exceedingly well in life? No, you will find people doing paraclinicals, people doing non-clinical subjects and earning more, doing much better in life. When you were born, did you say to yourself, okay, I'm born, so I will be a radiologist? No, it did not happen. It is all your interests are actually acquired interest if you look at it from one perspective. When I was in MBBS, I never thought about taking pediatrics. So it was only when I started preparing and I got a rank, I settled for pediatrics. Today, I cannot imagine being anything other than a pediatrician. And so the same thing will happen with you also. You may suffer for a few days, but if you adapt to it, if you excel in it, branch is secondary. कोई branch अच्छा बुरा नहीं होता. Every branch has its pros and cons. Excel in whatever branch you are taking. Be the best in that, and trust me, later in life, if you come across this video again, you will be thankful that you listened to me. So if you have taken multiple attempts and you are not getting through, it would be wise to take a branch of your choice and stick with it. If you have taken a single drop, or maybe you feel that you did not perform to your potential, you could not revise well due to some medical reasons or some personal reasons, and you can do it, you can take a drop. But remember, there is no turning back. Dropping and preparing is no guarantee that you will get a seat of your choice. Many times I have seen people who have got rank in the 10,000 and they take a drop and next time it became 20,000 despite their best attempt, because that is how the system is, that is how the competition is. So it is a calculated risk you need to take depending upon your risk-taking behavior and your financial, economical and personal conditions. And if you are a fresher, again I would say, branch, whatever branch you are taking, whatever branch you are getting, take it, stick to it. Branch matters, the city or college does not. Even if you get it in DNB, the DNB thing is immaterial, branch is the most important thing. And coming to people who have not got good results, many of you have sent that you are devastated. I can understand, I can totally relate to that. I have also seen some failures in my life. Remember that end of the day, it's just an exam. Yes, you feel bad. Yes, we are all humans, but life does not stop. Exams come and go. Every 6 months, there is another exam coming. If we did not perform well, ask yourself, what was the problem which happened with my preparation? Where did I go wrong? Work on them, and there is no reason why you should not succeed. Hard work always pays off. It pays off early for some, it pays off a bit late for others. So just persist with your efforts and you will get through. If you're targeting mid-year exams, if you've done targeting mid-year AIMS, PGI, JIPMER and the upcoming NIMHANS exam, 3 months or even less time is left. Start working right now. Begin with analysis, make up chart. Do not think about what happened in the NEET. Leave it behind and try to give your best shot. Even if you don't get selected, a lot of people say, sir, I could not get a good rank in NEET. How would I get selected in AIMS? Prepare as hard as you can for your AIMS and PGI exam. Give it with full force. You may not get a seat of your choice, but still, if you get a 55% above 50 percentile score, or if you get a decent rank, that will act as a milestone that will tell you that you are on the right track, and build upon it, and the next NEET exam will be 6 months later after that. So the exams keep coming. You need to keep working. You do not need to lose focus, lose hope. End of the day, it's just an exam. End of the day क्या होगा? You are already an MBBS doctor. You are the cream of the society. You have reached a place where few others have reached. Trust yourself, have faith in yourself, have respect for yourself. Do not take any wrong steps thinking about how will I show my face to others. Say to yourself, I'll work so hard that this result just gets wiped out by my next result. So work hard on your preparation. Start preparing for your exams. And for any other help which you want, you're most welcome to ask me about it. Exams आते जाते रहते हैं. Your life, your passion, you the person is more important. All the best.